And ladies and gentlemen, Ramadan Kareem, good morning, good afternoon, and good evening, wherever you are. We hope you're all staying safe in these difficult times. Thank you for choosing Canadian University Dubai, and welcome to our open house. Today we have a special guest, Dr. Rita Zghayeb, and the first half of the open house, she'll be discussing engineering solutions to combat COVID-19. After that, the second session will be about admission requirements and offers that we have running for the fall semester. Without further ado, I would like to introduce Dr. Rita to take the stage. Dr. Rita.
Hello.
Yes, go ahead, we can hear you.
Okay, hello everyone. So my name is Dr. Rita Zghaib. I am an assistant professor at the Canadian University Dubai. My research work focuses on Internet of Things, and in my research projects, I tackle especially aging population and their issues, healthcare applications and solutions based on semantic reasoning techniques, Internet of Things. Recently, I have a publication on disease and epidemic detection that I'm going to share with you today. Okay. Okay, so to start, I'm going to share with you today my knowledge and my experience with Internet of Things systems. And starting from Internet of Things, how we can help practitioners and doctors, society, and all the stakeholders with the healthcare system in fighting with coronavirus. So to start, what is Internet of Things? So Internet of Things is the intelligent connectivity of physical devices. So we start, or the starting point of all systems and Internet of Things systems is physical devices. So the basic idea is to implement in any environment to make it smart. So it can be your house, it can be the hospital, it can be the university. So we implement physical devices and sensors such as motion, temperature, light, pressure, and so on. We connect these devices to the internet, or we can call it to the cloud. And then once we connect these sensors to the internet, we start analyzing and receiving the data. So when we receive the data, of course, you've heard about concepts related to big data and AI. So how all of these concepts, Internet of Things, big data, and AI are connected together? They are connected through a system. So we start with the sensors, we detect some measurements, and we analyze the data. So of course, when we implement a lot of sensors, we are going to receive a lot of data, and here we have the term of big data. So, and the phase of data processing and analysis starts when we receive the data from the internet. We apply some algorithms and some rules. So for example, how we can detect if the temperature is high, we have to implement some rules saying that if the temperature is lower or is higher than, let's say, 40, so the temperature is high. Of course, this is a simple rule. However, we can implement when we have complex systems related to healthcare, for example, we need to implement some advanced algorithms such as AI. And finally, of course, we can visualize and check the data. This data visualization section is especially for the people who take decisions, usually in a company, for healthcare, and so on. So based on these analytics, they are going to take decision. So what's important thing also here is that Internet of Things usually and systems are made to improve the quality of life. So when we think about creating a system based on Internet of Things, we need to think about quality of life, business growth, efficiency, and so on. A smart home. So I'm going to take an example about of Internet of Things, which is smart home. So a smart home is a smart environment where we are going to implement many sensors, many physical devices. We are going to connect these sensors and devices to the internet, which will allow us to control remotely the heat, the light, various home equipments, and so on. So let's take an example of if we have a home, how to make it smart. So we start analyzing our home and to check the target. So we can implement, for example, smart steering, add sensors to the doors. If we want to monitor heating, ventilation, air conditioning, and so on. We can add some example of smart devices that we add to the home is smart smoke, fire sensor. We can add smart lights, control panel, smart sensors, contact sensor, buttons, and so on. A smart thermometer. And another example is connected camera. The cameras are always negotiable. We can discuss if the person wants to allow monitoring and his data and his footage to be on the cloud, and it's a matter of privacy, of course, and it's negotiable. So now that we have deployed and implemented physical devices to the home, it's not yet smart. It's the first step. So we implement sensors, and then once we connect these sensors to the internet, and we start monitoring and have remote access to these data from home, for example, from our work, for example, if we forgot to turn off the light, if we forgot to turn off the washing machine. At this stage, we can call it a smart home, and at this stage, we can say that we are monitoring our home and we have a remote access to it. So what is the advantages? Why are we creating this concept of smart home? Why are we adding these, creating these smart devices, adding them, and so on? Of course, there is a lot of advantages, starting from remote control, intelligent energy use of electricity when we forgot our machines on, the light, and so on. Remote security if we forgot to close the door, and so on. But especially smart homes have been recognized in the literature as a very important application and help health sector in monitoring the people at home. And we have defined a new concept which is called aging in place. So I'm going to talk about two important concepts that relate smart homes to healthcare. So aging in place and activities of daily living and health monitoring. So let's talk about aging of population and why is it become a major concern for researchers, and we have a lot of studies and projects, especially in Europe. Of course, you know that we have realized that more than 70% of people that are over 65, they like, of course, to spend the remaining years at home. So they prefer to stay at home. Of course, elderly people, they are more prone to chronic diseases. So you imagine how many times they have to go to the hospital. They have not only one disease, they will have like 2, 3, 4 diseases. All family members work, of course. So if elderly wants to stay at home, okay, but they need to be assisted They need, if by mistake the person fell down, so we need a rapid interaction, and we need to go to the hospital immediately. So it's a critical situation. We need to make elderly happy by staying at home, but in the same time, we need them to be safe. So from this point, start the idea of ambient assisted living, aging in place, and add smartness to the house. So we allow the people to stay at home, but safely. One more factor is the number of population and the share of population over 65, which is increasing in the world, especially in Europe. It's attending 20% of the population. So can you imagine the number of elderly that need assistance? Even if they want to go to a nursing home, for example, we need more staff to assist them. At home also, so as the number of elderly is high, so it's also an issue to manage. So the number or the aging population is increasing, and we have two options. So staying at home, so either the elderly will decide, I want to stay home, so we can imagine the number of travels to the hospital, the waste of time and money, and also the physical and psychical tiredness of for people around. So imagine you are at work, you are at the university, and suddenly you receive a call from the emergency that your grandma, your grandpa, they need to go to the hospital, or there is an issue at home. The other option is to go to nursing home, and of course we have also issues that we might face. Unhappiness of elderly, they are obliged to leave their home. And the second issue is even if we say, okay, let's allow them to go to nursing home, they will be safe and there will be someone to monitor them, we need more staff to take care of elderly. So the idea is, why not to combine all of these, and to so by combining these two issues, we said, okay, let's have a safe home, and from that we created ambient assisted living. So we have the smart home, we have all the technology around us, the sensor, the internet of things, the application that will assist and will help elderly to stay safe at home, and of course aging in their place. So as of the principle of Internet of Things, as I explained earlier, the most or the starting point for Internet of Things, whenever we want to create a system, we need first physical devices or sensors. So of course, researchers for many years have been investigated many sensors, so we can classify these sensors into three categories: wearable sensors, biosensors, ambient sensors. Wearable sensors, of course, all of you today, it's not new that we have bracelets, connected bracelets, watches. We can wear many physical devices that will help us to monitor the blood pressure, ECG, and so on. We have the biosensor that you can buy easily and bring at home. And we have the ambient sensors. When we talk about ambient sensors, we talk about temperature, humidity, all the contact sensors, buttons, and appliances that can be connected, washing machine, refrigerator, and so on. So all of these sensors are existing today. So we said, okay, perfect. So we have the starting point of creating an Internet of Things and an ambient assisted living. So based on all of these sensors that we have in the market, many IoT applications have arisen. So for example, you have an application for balance and mobility monitoring. You have one of the most important systems that has been created for fall detection, for example. You have also Apple Watch that assists with fall detection. So once the elderly wear this watch, we can send an SOS emergency message to the caregivers, to the family members. So this is an example of the system. So we have the measurement data, we connect to the system, and we send an alert message to the family members and to the caregivers. So we have an immediate action when a person falls. We also have, I'm giving you, of course, some examples of IoT application that we have for ambient assisted living, but of course we have much more. Uh, this is an example of IoT based ECG monitoring system. And this is another example for glucose monitoring. So it's a small patch that you can use, and you have for all of these applications, you can download the app monitoring. And even if you want to connect with your doctor, you can give him all the measurements that has been taken. So from these sensors, and as I have introduced the ambient assisted living, a new concept related to the activities of daily living of the person have been created in the research. So what is activities of daily living? So we said, okay, as we have a smart home, we have all the smart devices that we can use already existing. We have the wall lights, armchair we can add, and all of these devices. Why not using them and use this data and apply some AI algorithm and check the activities of daily living of a person. Of course, when we talk about activities of daily living, at this point, we don't use cameras. So this is one of the conditions. People usually, elderly, and even any person doesn't like to share. This is really related to protection, to security, and even to privacy. So we rely in all our application on ambient sensors and no cameras. And the idea is to detect the behavior of the person. So let's say if we monitor for 1 year the behavior of an elderly, and we know that every morning he wakes up at 10, let's say 9 a.m. He do some physical activity and then use toilet, breakfast, shower, and so on. So many research and many projects have been released already related to activities of daily living, and even I have some papers related to that. So based on sensors and physical sensors implemented at home, we can know what is the habit of the person. So why is it important, and how we can, okay, you can say that knowing the habit and the behavior of a person, it's okay, but this will allow us to know the anomalies of certain activities. So when we monitor for 1 year, for example, the activities of a person, and we know the normal life cycle of this person at some point, so based on this historical data, and when we have new life data arriving, we can know there is an anomaly. So we know, for example, today the person didn't sleep well, this person didn't eat as usually, or for example, one of the most topics that are discussed related to anomaly detection is the Alzheimer disease. When the activities of the person are shifted, he starts changing in his, we realize changes in his habits, and we can detect many diseases that I'm going to show you later on. So from activities, so now let's check the process again. So from physical sensors, we can have a smart home, we can monitor the activities of the person, check the behavior of a person, and we can achieve the anomaly detection when there is an issue. And of course, by applying AI algorithms and so on, we can detect some anomalies. So from anomalies, recently I have published, and it will be published soon, actually, it's accepted in a journal paper, disease and epidemic detection. And I will introduce this section, which will lead us to coronavirus disease. So if we analyze any disease, so any disease, it has symptoms. So how it has been defined? It has been defined, any disease, disease A, has symptom 1, 2, 3 until symptom N. So based on that, so how we can detect symptoms, how we can detect that we have symptom. When you go to the doctor, you will say, I have this issue, so he will detect symptom. Basically, we have realized that some symptoms can be easily detected by physical sensors. For example, the fever. The fever, we have many sensors that can detect the fever. We have so some symptoms can be detected by sensors, and other symptoms that cannot be detected directly using physical sensors, we can detect them by abnormal activity. So let's take a concrete example. I took gastroenteritis disease. This disease, as per the WHO, of course, resource and reference, it has fever as symptom, it has fatigue, diarrhea, and loss of appetite. So I'm going to take some example and some symptoms. So as a fever, you can detect it using a sensor. There are many sensors existing in the market that you can use. As a fatigue, also you can use pedometer, you can use your watch that will follow your activity. And as for diarrhea, as for now, we don't have any physical device that can detect directly the diarrhea. So we can detect it. We have proven that we can detect diarrhea if we detect abnormal activity of using the toilet, for example. And also loss of appetite we can detecting by abnormal activity of eating of the person. So if we monitor the person for 2 days and we know his behavior, and we know that this person for 2 days he didn't open any refrigerator, and of course we need to combine many data from refrigerator, from the kitchen, from different sensors, we can find at some point that this person is not eating, so he has loss of appetite. So based on that, so starting from physical devices, from activities of the person, monitoring his behavior and detecting abnormal activities, we can detect the symptoms of the person and finally detect the disease. Now, as we have defined a model to detect a disease from based on Internet of Things technology, epidemic detection. The definition of epidemic detection usually is when we detect the same disease in different apartments, let's say, or with different patients. So let's say at some point we have 20 apartments in the same compound that they have the same disease or they have the same symptoms. So it is a kind of epidemic. This project have been elaborated with colleagues from France and Norway, and of course in Europe they are really interested in building compounds for elderly, because of course as I based on what I have said earlier, so the number of elderly is increasing, the elderly population, so the researcher and the state are putting a lot of resources and projects to create such environments and smart environments for elderly. So we came up with an idea to implement such kind of system in a compound for elderly. And one of the scenarios, that a simple scenario, this was created before coronavirus, actually, before we have this situation. So we said one of the simple situation is the following: if we have like one building or 20 apartments in this compound who have diarrhea or they have gastroenteritis disease, so one of the things, either the food are poisoned or there is an issue in the food. So why not create an alert system to the cook who is cooking for all the compound, and please make sure so we can react easily. So because of course if 20 apartments and more than, let's say, 50% of the population have issues, so we need more take care and we need to put more money on monitoring their disease. So the idea is to implement this system in all the compound and connect all of these apartments to the internet, and we can check, apply of course some AI algorithm. For example, we can apply semantic reasoning techniques. In the paper, we usually rely on semantic reasoning techniques, but as future, we can apply any AI algorithm. We can check the number of persons who has the same disease, and then we can detect epidemic situation, and we can send an alert to the personnel. So now let's focus on COVID-19. So this was one of my latest research that I have done related to disease and epidemic detection using the latest technologies, starting from Internet of Things to the AI algorithm. and semantic reasoning techniques. Of course, COVID-19 information have been released, and we've been watching all the information on social media for more than 2 months. So basically, all of us know what is COVID-19 disease, what are the symptoms, starting from fever, cough, the prevention techniques. So I took this information from an official website for the WHO, and the transmission. The transmission process between person, and one of the things, of course, as prevention, we have to wash our hands with soap and water, wearing masks, gloves, and so on. So how Internet of Things and how all the information technology can help fighting coronavirus. So if we, I have studied coronavirus, of course, we can elaborate much more, but I picked some stages and some important aspects of coronavirus. Of course, coronavirus led to serious social and economical impacts, and reactions must be done as soon as possible. As for now, we have four main aspects that we can study. So more we have infected patients, we have confinement, we have the hospital loads, we have the lockdown, and working from home aspect. So I'm going to talk about these specific aspects related to coronavirus. So this epidemic had led people and the government to announce lockdown. So this lockdown has led to close all the supermarkets, the malls, so people cannot go out, which led to working from home. So the lockdown had especially economical impacts and also social impact, as people need to work from home, so we need to assist them from home. As for the confinement, so every infected patient, so it depends if his status is serious or not. If it is not serious, so he need to be confined for 14 days. So this stage also need help from technology. And if the patient status is serious, so he needs to go to the hospital. And of course, you've heard about the load of hospitals, and they need to manage more. So we have a big issues in hospitals also. So as I have picked these four important aspects in coronavirus that coronavirus has released. So how Internet of Things, data analytics, and AI can help with these issues. So I have also created a classification of already existing solutions and some proposals into four categories. So first, we need to prevent coronavirus. So less we have infected patients, we have, it's better, of course. We are going to reduce so all the other aspects and factors will decrease. So we are going to have less load. We are going to have the confinement. So we'll not have a lot of people to confine. The lockdown will be finally ended. So as a first classification of systems and technology that to provide is prevention techniques, we need assistance in detection step, monitoring, and entertainment. So prevention to prevent more cases, detection already to help people not to die at least, or to detect as much earlier as we can. And monitoring, once we have detected this disease, we need to assist health specialists in the monitoring, and of course doctors, nurses, and so on. They need to take care also. We cannot give them or allow them to stay face to these infected patients all the time. So as much as we can reduce the contact with the professionals, it's better. And finally, why not entertainment and help the confinement in the confinement phase, and when people are confined, so we help them to release the tension that they have. So I will present some of the techniques that exist, and I have added some that I think that we can use. So you see that many states and in many airports in the beginning of Corona, they have used thermal sensors to scan the body temperature. We have this kind of sensors, and we have the non-contact thermometer and camera. In many cities also, this technique is offered to all people that want to check if they have corona. So they just book an appointment and go through this system to check if they have corona or not. We have also drones that has been released. They embed some aerial thermography and thermal cameras. So they go around, for example, a mall or around the city, checking people if they have high temperature. Of course, I put this as prevention, but one aspect that is very, very important, fever is not the only factor that proves that we have or a patient is infected. So this is one of the factors. It can be it's kind of prevention. So anyone who has a fever, so maybe we can consider it as a suspect of coronavirus. So we cannot rely on this technology for detection. We can rely it as prevention only. We have many robots that has been created for disinfection. As you know, for coronavirus, hygiene is a very important aspect, and many robots have been created for disinfection. Even at home, you have many robots, and even in at the scale of city and states, we have many drones and even robots for disinfection. One delivery robot is one of the prevention techniques. You can use it at the hospital. So if the nurses doesn't want to have contact with the infected, so you can use this delivery robot. Even at the supermarket, we can use it, and we can create such kind of robots to deliver the products to the patients. So we reduce the contact with the people. And as an example of projects that I have thought about and I'm working on now is a device. Of course, what we need to think about is after coronavirus, after the lockdown. Are we going to go back to our normal life? We are going, all of us, to go to the malls. You see lately when in Dubai, especially, the government said, okay, we can go to the malls. So the lockdown is not finished 100%, but it's kind of, we can go out. You see the number of cases that has been even in all the countries actually has increased. So we need to take some measurements. Why not create some AI systems or in IoT system that will manage the number of person in supermarket or even in the mall. So instead of letting anyone enter, even if the fever and even if we are taking all the security management, so let's for example, at the first stage, we can have a system that count the number of person. For example, if we realize that at a specific place or in a specific shop in the mall, we have a lot of people, so we can alert the management of the mall. So we ask the people to go to another place and so on. As detection applications or systems, I will go back to the research that I have published recently. So we and even some press release have recognized that Internet of Things, network systems, data analytics, and AI are going to be a very important systems and can help in early detecting the infectious disease in general, and especially COVID-19. It's very important to detect early, at an early stage, coronavirus, because when you detect early, you reduce the percentage of contact of the person. So we will know at the first, especially after the lockdown, if you allow, for example, 30% of people to go back to work. So at a company, university, in the mall, we need to implement some systems to detect early if a patient, or if a person, sorry, it's not patient yet, if a person is infected, so we don't spread the virus in our company and so on. So some of the symptoms that can be I checked are, for example, the most common: fever, cough, tiredness, and the less common but are important also have been seen a lot: diarrhea, headache, loss of appetite, and so on. You can see as really it's a coincidence that most of these symptoms that I have talked about in different diseases, so we can detect them using sensors, using abnormal or anomalies in activities of daily living. So we can rely on a disease detection system and epidemic detection that I have presented, and we can focus especially on coronavirus. So we are going to see later on. So this is, I tried to just do a figure to illustrate coronavirus. So as you can see, we have the fever, fatigue, diarrhea, loss of appetite. All of them can be detected using Internet of Things technology. Of course, applying AI algorithm, we can detect if a person has a coronavirus or not. To arrive to monitoring, telemedicine has been recognized as a very important technique to monitor and to as an effective way to monitor coronavirus from home. As I said earlier, doctors, medical specialists also need to take care. We need to reduce as much as we can the contact between persons, the patient, and the medical specialist. So telemedicine is one of the really powerful way to rely for telemedicine. All the applications that I have talked about can assist the doctor in their diagnosis. All the glucose and ECG, all the different measurements can be taken using very high and accurate sensors today. So why not relying on this technology to help the doctors? Also, one of the monitoring systems that is being discussed now in the literature and in the research area are face recognition and AI algorithms. Especially mobile apps has been built to check if people have taken the same train flight with the people who have discovered with coronavirus, so we can test them to check if they have a coronavirus also. So it's very important to monitor if a person has been detected as positive, to check the family, all the people, the acquaintances, and so on. Finally, as entertainment, so we have tackled the aspect, let's say technical aspect, all the biology and the disease concept related to, let's say, disease symptoms, how to deal with all of these. But also entertainment and social life is very important. We have seen many reports about the mental health of people who are staying all the day at home. It's tiring. People are really not feeling well, staying all the day at home, and even for people who are isolated. So in all cases, we need to assist them in different way. We have some studies talking about office home robot to assist the persons who are working from home. So you know that most of the people now are working from home, and many applications such as Zoom, for example. Thanks to Zoom, now we are meeting today. So we have this technology that help with work, but also a lot of work must be done later on, because many breaches have been seen. The security is very important issue. Many applications are facing many attacks and so on. So this is ongoing work, or what I have presented now is ongoing work. There are many research projects, but of course they need to be more improved. Alexa has been also has an important role in entertainment, especially for isolated patients, for music, if the person wants to do some physical activities, get some information. He can talk with at least Alexa, since he cannot have any contact with persons, or even he can call with Zoom and so on. So you can see how really information technology and all these advances in technology, Internet of Things, and all of these are really helping the society and helping for better quality of life. So with that, I arrived to the end of my session. Of course, I have much more to share with you, but I tried as much as I can to summarize all these technologies. If you have any question, I am here to listen and answer your questions. Thank you for your attendance.
Hi, Dr. Rita. Unfortunately, because of the time, we're only going to take one question for now. Do you think the increased implementation of AI and robots will replace jobs that humans can do?
Okay, good question. Of course, we cannot say that robots are not replacing at some point some jobs, but you can see that some jobs are replaced. But from the other side, we have jobs that are proposed. For example, especially in information technology and all these domains, we need more specialist. So why not doing computer science and joining our university for that? I'm joking, but really this one of the domains that is increasing is everything related to technology. So it's increasing, but of course it's replacing some other jobs.
Thank you so much, Dr. Rita. Now I would like to ask Kristen and Christine to present the admission requirements and basically entry requirements to the university. Kristen, take it away. Thank you again, Dr. Rita. Thank you so much.
Thank you.
Everyone again. Thanks for tuning into this session on the open house. And thank you, Dr. Rita. That was really interesting, especially considering the pandemic right now. So we're going to start with a little bit about the university and admission requirements, and then Christine is going to talk about scholarships, discounts, and apply. I don't think okay. I should be sharing right now. Can you see?
Yeah, you're sharing now, Kristen.
Okay, good. Sorry. Okay, for those of you who don't know, we are moving to City Walk in September. So this is a really exciting time for us. Our campus is going to be new, more modern, especially for our engineers, because we're going to have state-of-the-art laboratories. And definitely for our business students, I believe that faculty will be there as well, and it's right in a business hub. So there is a lot of questions surrounding equivalency certificates. So we are accredited by the Ministry of Higher Education here in the UAE, in which every single student is required to have the certificate. We understand that right now a lot of the offices are closed and a lot of you don't have your final documents. So this is something that myself and the recruitment team are here to guide you on. So as long as you know that it's something that you have to get, preferably by September, we do give our international students at least 6 months to gather their documents, because it does take some time to get things stamped from embassy and then here to Dubai. So going over our systems and requirements, the American system, we need an overall of 60%, and you have to have grade 12. With the American system, you should write your SATs. We do only look at the math mark, and that would be a total of 450. And then a 500 if you are MSAT, and MSAT is a local test here. English requirements are the same across the board. So anybody who's wanting to just study in Dubai, we just need a 5.0 in your IELTS or a 61 in your IBT TOEFL. 1100 in MSAT, again, that is a local Dubai test. So just keep in mind that those of you who do want to transfer to Canada, you should be aiming for a bandwidth of 6.5 in your IELTS and the equivalent. Oh, just to go back here, especially because a lot of you, I've seen your names, and I know that a lot of you are engineers. There are a few different requirements for our engineering, especially with our electronic and mechatronics students. We do require you to have a higher math mark. You should be taking calculus, physics, and one other science. We prefer chemistry. British system, we should have 5 IGs in your O levels. They should be a C and above, and 2A S levels or 1A, they should be a D and above. Again, for the engineers, we do need you to have preferably calculus and then 2 other sciences, and preferably physics. And then if you don't achieve an 85% in your math, then we will need to do a math placement test. And then the same English requirements are across the board for each system. IB diploma is 21 points, 3 higher level, 3 SL level, and of course, you need to be in the science stream for engineering. English requirements, again, the same. CBSE system, you should be in the science stream if you're applying for engineering. Completion of grade 10 and math needs to be taken as well in grade 12 if you're applying for mechatronics or electronic engineering. If you're looking to do computer science, then we can also accept you with just a grade 10 math mark. How to apply? Preferably, you would have already applied with us. The easiest thing to do is get in contact with us, and we can actually do your application for free right now during the month of May. If you do want to go online, it's very easy. You just go to CUD and apply online, and basically you put in your program requirements, your contact information, and then the best thing to do, sometimes the documents are a little bit larger and they're not necessarily able to be loaded onto the system, so it's better to maybe just get in contact with us, and Christine is going to show you how to do that in a minute. Documents required for your online application. Everybody does need a passport, especially international students, and then local students, you can also provide your Emirates ID. Now the transcripts, of course, we understand the situation right now. Not all of you have received your final grades. Maybe your school is assessing you in a different way. We know that some of the CBSE exams were canceled, and they're assessing you with all of the work that you've done throughout the year. So what you can do, you can still apply. This is the main thing with just grade 10, grade 11, and we just need something from grade 12. So whether that's your first term results, I've had a teacher give me predicted results for a student from final grade with just a stamped letter. If you have access to a portal and your grades are shown there, if you can do a screenshot, we're accepting that during these times, because we know it's we have to be a little bit flexible with you guys because you're under a lot of pressure right now. Of course, we need SAT math scores for those American curriculum students. We know that also those testing centers are closed, so whenever you can provide it to us and they're open, we're happy to take it, but we will do everything case to case basis. So if you can give me your marks for grade 12 first term, but you don't have your SAT yet, that's fine. And then of course, with IELTS and TOEFL, the testing centers are still closed. We don't accept any online practice tests or anything like that. It has to be the real one in person. But again, we can still give you a conditional acceptance without your actual physical TOEFL test. Preferably, we would need it by September. A lot of the students had asked me, what happens if something's not open by September? Of course, then we're going to reevaluate everything. But typically, if you've taken your courses in English, usually you should be okay. Programs and majors, just to quickly go over a few of our faculties if you are still out there and not knowing what you want to study, but we do have architecture, interior design. Because this was an engineering open house, we have the 3 types of engineering: computer network engineering, electronic engineering, and mechatronics. For those of you who are not familiar with mechatronics, it is very similar to what Dr. Rita was talking about today. It has to do with robotics and with software, so it's hardware and software. We have a faculty of communication, so those of you who are interested in journalism, advertising, public relations, and then we do have our creative industries program, which is new just last year, sorry, and in coordination with Ryerson University in Toronto. So anyone who's interested in fashion design, media business, they should be looking at those. Of course, we do have psychology in both Arabic and in English, and sociology in Arabic. Environmental health management is also there for those of you who are interested in science, what's related to the environment, and then from a hospital management point of view. And then our faculty of management, which is our biggest faculty. And as you can see, we have, I believe, at least 9 or 10 different concentrations that the students can definitely explore. So I think that's it for me, and I'm going to pass it over to my colleague, Christine.
Thanks, Kristen. I will take over where Kristen left off. So just to let you know about the fee structure, first and foremost. So each of our faculties has a slightly different price range. So you can see here they vary from about 62,000 dirham per year to 73,000 dirham per year for architecture and interior design. So that covers the annual cost based on a full-time course load. So that's estimating if you do 5 courses per semester for 2 semesters, that's full-time, which puts you on track to graduate in 4 years. You can, of course, take less than the recommended course load, but you would extend your degree beyond the 4 years, or you can take courses in the summer to make up for it. And most people are interested in our fee reduction opportunities and scholarships for the fall semester. So just so you all know, we are offering 30% off the first semester's tuition fees. There are terms and conditions that apply, so please get in touch with us. If you have an application started with us, or if you have not yet started one, you can start one and you can still make the application deadline and get your first payment in order to avail the 30% fee reduction offer. Secondly, we have scholarship opportunities that range from 20 to 30%. So students who avail the fee reduction opportunity can actually attain up to 60% when you add on scholarships. So we have different types of scholarships for academic excellence. So for students who have a grade of 85% or above, they qualify for this scholarship. Sports scholarship, if you play on any school sports teams. A lot of people think you have to play professional sports. You don't. It's just for participation in your school sports teams. You just need like a coach recommendation, participation certification, and awards. Anything you can use to support this scholarship, you can apply for that. Financial hardship scholarships. So the application can be filled out and you submit your supporting documentation with salary certificates and other tuition payments for the working family members, special needs scholarships, and also special talent scholarships for students who have talents other than sports and want to apply and participate in our on-campus clubs, and they can contribute to that. We are more than welcome to apply. So for anyone who does not have an application in with us, please email info@cud.ac.ae, whether you've started an application and you have trouble finishing it or you have yet to start. Like Kristen said, we are here to help you. You can send us your documents so you can make it even easier than just applying online. You can send us all your documents and we can help you finalize the application. You can also ask more questions about the programs we discussed today, the fees and the scholarships, anything you like before you're ready to start your application. We're more than happy to give you the information you need. And another way to get in touch with us is by visiting our website, and you'll see this banner and you can click book now in order to book a virtual information session. So it'll be a one-on-one Zoom session. We can share our screen, or you can share your screen with us, and we can walk you through the application step by step. Or we can also just give you more information if you have yet to apply, or if you already have acceptance with us and you need more information about payments and registration, we're more than happy to help you in any way we can. So those are a few different ways to get in touch with us. So I hope you all have our number. We will get back to you when you call this number, and we also have the email. So that might be the best way to get in touch with us now. Or if you have our personal emails already, just keep in touch with us because we're always more than happy to help you.
And just to add one more thing that's the most important, transferring to Canada. We did have an open house about it a few weeks ago. But of course, we have over 23 partners directly in Canada, but you're not limited to those partners. So for those of you who are interested in studying with us in Dubai here for 1 or 2 years and then finishing your degree in Canada, that's definitely something that we can help you do. Especially for the engineers, we have our direct partner is Queen's University. It's one of the best engineering schools in Canada. So any questions about that, we can definitely answer.
Yeah, of course. So for anyone who was planning to study abroad and wants to start locally so that they can transfer after, we can help you transfer your credit. So we have a lot of success transferring to our partner and non-partner universities in Canada or abroad. So please get in touch with us. And I think now we'll just go on to taking questions. Abdulrahman, are there any questions?
All right, so we have a question from Zanil. When is the deadline for submission of documents for the fall semester?
Deadline, we will accept students right up until the registration in fall, but it's best to get your application in before the end of this month to avail the early registration fee reduction opportunity of 30%. So just email us right away, email info@cud.ac.ae right now, and we'll get back to you and we can start your application today.
All right, there's another question from Aya. How do we submit the application without the fees?
Best way would be with us. I know that a lot of you have been trying to do the application online, and you get to the very end and it asks you for 525 dirhams. Just get in touch with us, Aya. You can just leave your number with Abdurrahman or your email, and one of us will contact you, and we'll do everything from the back system.
And we have a question from Sheila. Has it yet been confirmed if the classes will be online for the fall?
I don't.
No, not yet. Another question. How can we apply for summer 2 courses?
Same way. So either you can start the application online and you can just put that you're interested in the summer 2 courses. Just keep in mind that we don't offer as many courses during the summer. So it's probably better for us to do the application for you, so we can kind of guide you and see if summer 2 is the best fit for you, or if maybe summer 1, which is still starting on the 17th of May and we're still open. Or if fall is a better fit for you.
And there is a question. What is the amount of the first payment to be made before 31st of May?
The current deposit is $2,500, so that'll be deducted from your first semester's tuition fees. So that's the amount that has to be paid by May 31st.
I think it's approximately $600 US, if for those of you who aren't in Dubai.
There's a question from Hussein. I have completed 5 subjects in IGCSE and 2 subjects in AIS levels, and I'm yet to give the A-level part of the same 2 subjects. I want to know my eligibility for my bachelor course in architecture. So
you can be accepted with 7 courses. So 5 O levels and 2 AS levels. So if you're going on to complete your A levels, you should have math if you're planning to enter architecture. But other than that, it sounds like you're eligible as long as you meet the grade requirement, which for that course is, I believe, 70%. And as Kristen mentioned before, for the math mark, it's the same as engineers. You have to have an 85% in math, but you do have the option to take a math placement test with us or pre-calculus if you didn't quite meet that math requirement.
And you should have physics as well, hopefully.
For architecture.
Yeah.
A question from Abdurrahman, not me, another Abdurrahman. I live in Turkey, so what are the important documents to apply for a scholarship?
Well, Abdurrahman, it depends on what scholarship you want to apply for. So academic, of course, you need your academics and your final. We can base the scholarship on your predicted marks, and then provided you meet that mark for your final requirements or higher, we'll adjust it. Sports, of course, you need to provide certificates or, just proof that you've been on a team, participated in some way. Financial hardship, there is a long list of things. The best way to do is to maybe just contact one of us and we can send you the requirements and the link for it. But financial hardship would be if you're living with your parents, we need their rental agreements or mortgage payments per month, their salary per month, if they're supporting any other students in school, and their salary per month. So, and then special talent we do have for anybody who's interested in singing, dancing, anything that has to do with music. I think that answered every question. A lot of people have actually done video submissions for the music one.
There's a question, what offers do you have for the fall semester? Fee reduction offers.
So we have the 30% off for meeting the early registration payment deadlines, which as of right now, I think is a 2,500 dirham deposit and 25% of tuition fees by June 30th, if I'm not mistaken. So just get in touch with us and we can send you more information directly about your exact tuition fees and the payment structure.
One more question. I don't have my results yet, my final results yet. Can I still apply for the fall semester? This is a question from Ahmed.
Yeah, you can definitely apply. So we just need, admissions needs something from grade 12. So like Kristen said, it can either be first term results, it can be predicted results. So a letter from your school stating your predicted results for the end of the term, or any like pre-board or mock results that you have. So if you can't, like students don't have their final results yet, but we've already issued a lot of conditional acceptances for fall semester. Are currently in grade 12, so you should definitely apply.
All right, I think that's it for us in terms of time. Thank you everybody for coming to the open house, and we hope it was informative for you. And we'll see you again most likely next week, so stay tuned.
Business.
Thank you, Kristen.
Thanks, everyone.
Thank you, Christine. Thank you, Kristen.
Bye guys, stay safe.